Hello, everyone. It's June the 24th. It's our briefing today. Very regretfully, I have to report to you that we have lost 3 more wonderful West Virginians. We lost a 73-year-old male in Mineral County, an 88-year-old female in Lewis County, and a 66-year-old female in Clay County. These are our 90th, 91st, and 92nd deaths in West Virginia. You know, we all know, we watch the television every day, and if you watched all across this great country every day, the death toll just keeps growing higher and higher. You know, we all know this killer virus is a pandemic like no one has ever seen, and it is a killer. And we all know that between now and when we ever come up with a vaccine, and we hope and pray the sooner the better, that we're going to continue to lose people. So what do? We've got ultimately extreme choices on both sides of the situation. We could all batten ourselves down in our houses and we would probably still lose people. But at the same time, it would surely be better, or we can try to go forward and there's genuinely some level of higher risk. Now, if we batten ourselves down in our houses and we lose all control of the economics of this great country, we all know of the terrible depression that happened in the early part of the 1900s, early mid-1900s. You know, we all know the devastation and death toll and the hunger and the neighbor against neighbor and all things that can happen to an out-and-out teetotal collapse of our whole way of life. So, we've got a choice in between, and we go forward. And we try to manage our risk, and that's what we're trying to do. Now again, I want you to know just this, that I depend on people, and I really depend on their accuracy, because see, I'm really hung up on the right numbers. You know, if I tell you it's a 7 today, I want you to be able to come back day after tomorrow and come back in 3 weeks and it'd be a 7. And I am hung up on that. It's not good enough for me that it's close. You know, naturally we can't be perfect, but I want to be transparent at all times. I want to be accurate and transparent at all times. And I demand that of our people, and I have demanded that since day one. Now, I can tell you this, that there was a situation that happened in Jackson County, and we are still investigating what actually happened there. And to be perfectly honest, I told you that I would not be happy if those results came back and I would act on it, and I would act absolutely right then. Well, we're still waiting for all the true up of the whole investigation of what happened in Jackson County to come back. Now, I get it. I completely understand that everybody's got a great big rope to pull here, and everybody's trying to do somewhat of the best that they can possibly do. But if in fact we find that really and truly that I told everyone to test every single person at that nursing home and we didn't do it when I told them, then I'll act. And that's what we're working on right now. In addition to that, the reason that I bring that up today is just this. We now have every reason to believe that numbers that I have been reporting to you the last few days are maybe inaccurate. Now, they're inaccurate to the good side for us, but that doesn't matter to me. And what I mean by that, we really believe now that I've been reporting to you that we have more active cases than we really have. And so really and truly, you could say, oh, it's a great day. It's a great day, because really, Governor, we really found out we don't have as many active cases as we've been telling you, Governor. Well, that ain't gonna cut it with me. It's their job to tell me the right number. And the perfect example that I could tell you is just this, is at Huttonsville. At Huttonsville on, I think, the days are all running together, but on Monday, I came to you and said, at Huttonsville, we only have 6 active cases today, and it's our only jail that we only have in our state. And I bragged on the corrections people and said how great they're doing. In fact, and that's right. That's right. But do you know, on our total number of active cases in our state, we weren't taking that off of our total number of active cases, and we weren't doing it and everything. And there's either a breakdown at the local level, there's a breakdown within our level, but here's the bottom line, and here's the whole thing to me. I mean, if we were on our game here in DHHR, in Dr. Slimp's office, if we're on our game and you're listening to the governor say that there's 6 active cases at Huttonsville, and you're looking at the reports that you're putting it together and sending them to me on active cases, and you're looking in Randolph County, they're reporting 100 and some odd cases, then you're not doing your job. And you're not having the passion behind what you're putting together, because basically these numbers are better. Now, I don't know that they're gigantically better. I don't know if it's 8% or it's 10%, but whatever it is my responsibility to tell our people the right numbers. And when I overstate the amount of the problem that we have, and that's what it is, it's a great day from the standpoint that we don't have as many actives as what we thought. But really and truly, if I overstate the number of actives, then I'm scaring you. I'm scaring you when I don't need to scare you. And that's not going to cut it with me. We'll get to the bottom of it, we'll act, and we'll get to the bottom of this really quickly. Again, I hope and pray that everyone will remember these 3 individuals that we lost, great West Virginians, and please keep them in your thoughts and your prayers. I say over and over and over, these are people. These are not numbers. And the point in time when they become a statistic is a terrible point in time for all of us. They won't do that on my watch. This is the week 9 of our West Virginia Strong, the comeback reopening. All your guidance and everything and documents are up on the screens and on my websites. I want to talk to you again about Myrtle Beach. Now we have, there are 19 outbreaks in 11 counties that are tied to people traveling to Myrtle Beach. This is up 6 more from our Monday report. We have 13 in Berkeley County, 5 in Cabell, 1 in Fayette, 2 in Greenbrier, 8 in Kanawha, 1 in Mercer, 2 in Putnam, 32 in Preston County. And I think it says here with the possibility of 10 more. 6 individuals in Raleigh County, 1 in Ritchie and 1 in Taylor. I strongly would tell you that if you're thinking of going to Myrtle Beach, rethink what you're doing and everything. And the other thing is, if you have been, go get tested. It's really important that you do that. In regard to our church outbreaks, we have no additional outbreaks in churches. We still have 3 active church outbreaks in Ohio, Greenbrier, and Boone counties. In Ohio County, we have 18 positives, Greenbrier 41 positives, and Boone 9 positives. And I strongly urge just what I've said over and over, every other pew, social distancing, wear your mask, wear your mask, wear your mask. The church setting is probably one of the ripest settings that you can possibly be in to transmit this terrible disease. As far as our grants and everything, we're still processing stuff. I just had a discussion with our people in regard to our cities and counties to put on. I don't care how many people we've got to put on to get these dollars out the door and get them out the door. The faster, the better. They're telling me, that there's once they receive a letter, we have 10 days. We're absolutely always within that window and everything. And I'm saying absolutely that's not even good enough too. We've got to do better and better and better. And just so we're going to put on more people. We're going to push and push and push from the counties and the cities. Get your applications in faster to us, and we'll get them back to you, and we'll get those monies right to you. As far as our free testing, today we're in Boone County. Also this week we'll be in Lincoln, McDowell, and Wyoming counties. The weekend we'll be in Cabell, Hancock, and Mingo counties. It's all free. It's painless as it can be. It's nothing. Run by there if you have any concern. If you're one of our minorities and you want to be tested, please go get tested. It gives us more information on being able to help our minorities, our vulnerable people. Please, please go get tested. The more we're tested, the better off all of us will be. Our summer feeding map is still up there. If you've got a problem, call 211. That's 211. There's 670 sites and everything. We want all West Virginians to surely not go hungry. On our jail update, today I'm told, and this flies all over me, but today I'm told we have 3 active COVID cases at one prison in Huttonsville. We got to get our act together and clean up our numbers and get our numbers right. If you don't want me on your hiney, and you best better get your numbers right to me. On our foster care payments, the West Virginia foster families and providers are heroes in every way when it comes to providing safe homes for our children. You know, I got fired up about a little kid, Landon. I wish to goodness I could put his picture up there. I'm so blooming proud of him. It's unbelievable, but I want all of us to recognize just the effort that our foster families are making and all the greatness that they do, and absolutely, I commend them. I love all those kids, and I just want goodness for them. I mean, that's all there is to it. Today, I'm announcing that DHHR is issuing a one-time payment to foster care families and providers as part of the state's ongoing response to COVID-19. The payment will be based upon the number of children in the home or facility at the end of June 2020. This payment will provide in-state foster families, child placing agencies, residential and emergency shelters additional financial help for costs related to the COVID-19 pandemic over the past several months. So that's good news that we've got money going out that'll help these kids and help these families and help the people that are working in the foster care communities, because they are, whether they be at our facilities or whether they be, going home to home or whatever they may be doing, they're doing great, great work. On the unemployment situation, last week Workforce West Virginia reported that West Virginia's non-seasonality adjusted unemployment rate decreased to 12.5% in May. You all know that at one time not long ago, we had an unemployment rate, I think it was less than 5%. And so we've still got a ways to go, but we're doing a little bit better there. Yesterday, the county level data showed that the unemployment rates decreased in all 55 counties in the state in the month of May. Good stuff, good stuff. And I want to make myself a note real quick, I want to talk to you just 1 second about the money here and tell you what's coming on that. But I remind you again about the census. I got on the phone with Coach Pruitt just a little while ago. He said him and Coach Nealon would welcome doing a public service announcement, especially working some of our southern counties and everything where we're lagging behind, but to be able to help us with the census, and I'm going to surely have them do that as well as anybody and everybody we can. We got to get counted. It's really, really, really important to get counted. Let me tell you this. Yesterday was a day that Jim Justice will remember for the rest of his life. A day that was the 4th anniversary of a flood situation that was unbelievable. And we know it in all kinds of different parts of our state. And some of our parts of our state, we don't probably remember that. But we lost all kinds of people. You know, it was a time that I was right dead in the middle of it. It was a time that I tried to help people, you know, at their homes, and watched all their possessions just being loaded up in dump trucks and gone away with the mud and everything. It was a time where we waded mud and we looked and looked and looked for 6 weeks for a little 14-year-old girl that we finally found miles downstream. It was a time, literally, that we saw people come together and do great work, and it was a time that has been an eyesore on lots of us from the standpoint of whether it took 10 minutes or it took years to work through all the wickets to be able to help those that needed to be back in their homes and everything. It was either 10 minutes too long or weeks or months or years too long. You know, there are situations with disasters that take forever and a day. But I want us to all recognize that yesterday was a day that will live in our hearts in this state for a long, long, long time, if not forever. It was single-handedly the worst event that I have ever been through in my life, as well as lots and lots of others. I've got to tell you this story about a guy that, you know, that at my basketball games where I'm coaching, forever there was 2 men that ran the clock and kept the scorebook. One was Tom Bill Dudley, and Tom Bill, you know, had, I think, pancreatic cancer. And his home was completely washed away. And we lost Tom Bill not long after that. The other fellow that sat within probably 8 feet of me, his name's Ronnie Scott. And Ronnie, at his home, if I remember exactly the story correctly, Ronnie was at his home with his wife, and he said, I'm going to take the kids and get over here to high ground. You take the vehicle and get over to high ground, and I'll meet you over there. Well, one thing or another happened, and she decided she needed to go back to the house because, from what I understand, the dog was still at the house. And she went back to the house, and all of a sudden, Ronnie's looking for her over on high ground, and Ronnie can't find her, and his phone rings. And it's his wife. And his wife says, Ronnie, I'm at the house. I came back to get the dog, and now the water's too high for me to leave. And so Ronnie's looking for her like crazy, and Ronnie's not a very big guy. He can't find her, of course, because she's at the house. And the rain is just pouring down on him. And as he told me, he said, you know, it was so cold. And he said, I was trying to crawl up a bank to be able to get to where I could see the house. And the phone rang again. It was his wife again. And his wife said, Ronnie, I smell gas, and I'm in the attic of the house. And then Ronnie kept crawling to get higher and to be able to see. And then he heard this unbelievable explosion. And she was blown into a tree not far from there, and we lost her in the next couple of days. Now, I'm telling you, that was a time that was beyond belief terrible. And so for all those that went through that horrible tragedy, you know, let's don't forget them either. And June 23rd will live with me forever and a day. I want to go back and just tell you just one other thing real quick, and that is at a Buchanan stockyard in Upshur Buchanan, you know, the Upshur Buchanan Health Department has confirmed that there's 10 cases of COVID from attendees that were at 2 different auctions that were held at the Buchanan stockyard. And these 10 cases are associated with a family-run business in 2 counties, and that's in Upshur and Lewis County. And with the last case identified, that was identified on June the 18th, and the concession area was in operation during the auction at a 50% capacity level. What we're asking, is that from the public standpoint, if you may have attended this auction, please contact your local health department and they can assist you in any level of contact tracing. We need to be able to do that and everything to try to nip this in the bud as best we can. The stockyard's been closed and will not reopen until those that are positive have been released from quarantine. We just need to try to be able to do all that we can possibly do. So if you were there, please contact your local health officials so we can try to get a grip on that in a better way. The only other thing I can tell you is if you go back and you look at our charts, you'll see this instantaneous little dip down in active cases. And, I can tell you that the reason that dip down in that second line in the top is so severe to the downside. And if you don't think it's severe, we were at 778, we dropped to 686, just boom. Well, it just doesn't work that way. And the reason that that's happened is because we had overstated the amount of active cases we have. Now, if you're going to get something wrong, we would all be happier if we got it wrong that is a wrong that is to our good side. And it is. It's a wrong to the good side. We don't have as much of a problem as we thought we had, but that's not good enough for me. On our daily percent of positives, we're at 1.93. On our cumulative average now, we're at 1.68 or 67 rather. I think that's really about all I've got to report right now, and we'll take your questions in just a few minutes. Thank you.
All right, thank you, Governor. First, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. The governor pointed out a number of testing lanes will be going on this weekend. So Guard is preparing for those, as well as currently today supporting testing at our state veterans homes with the staff, again, at the governor's direction to continue to double down on protecting our veterans. We're also testing at our bases at the 130th and the 167th and our state headquarters here in Charleston. We continue PPE distribution, which will be going out again throughout the state of West Virginia. In addition to that work, we are also beginning today work in Alderson, covering Greenbrier and Monroe counties as far as support to the governor's state of emergency and the debris removal for those two counties. That will be followed up by Friday, a return to Fayette County to finalize some additional debris removal work that is requested by the county emergency management folks. And then the last thing I'd like to leave folks with today, tomorrow is the 70th anniversary of the start of the Korean War. West Virginia National Guard had two units, the 1092nd Engineer Unit, which conducted major operations in 1951 and 52, particularly around what was called the Imjin River area, and supported a major operation for Allied forces there. The 167th Airlift Wing, now out of Martinsburg, West Virginia, completed 806 combat missions during their deployment to Korea, and we lost 3 West Virginia National Guardsmen shot down during those operations. Today, there are still 8,000 United States service members who are unaccounted for from the Korean War. So I'd ask all of us to remember all of our Korean War veterans, as well as those who made the ultimate sacrifice in that operation on behalf of our great nation and our allied forces. Thank you.
All right, thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. I want, as I often do, to reinforce what the governor has told us. We are still doing well as a state. But as we look around us in the region and also nationally, we can see that the COVID virus is starting to expand in states like Texas, Florida, California, Arizona. They are seeing the logarithmic slope of COVID spread. For instance, California yesterday, I believe, yesterday had about 5,000 cases, as did Texas. Florida had 3,500 cases. I'm sorry, Arizona had 3,500 cases, and Florida had about 3,000 cases. And if you compare that to West Virginia, we are hovering around 2,600 cases. So while we are doing well, we know that our R value has increased over 1, which means that the COVID virus is spreading in West Virginia like it is in other places. Certainly part of that assessment is related to our expanded testing, but we also know that COVID is spreading everywhere, including in West Virginia. And we see the impact of travelers going out of state and bringing some of the COVID virus back with them, as we've talked about, from places like South Carolina and other states where there is more activity. Of note, New York City has now caused people coming in from outside of, or New York State, I'm sorry, people coming in from outside of New York State to quarantine themselves because New York State is doing better. And as we pointed out before, at a country level, we represent 4% of the world's population, but we account for about a quarter of the COVID cases and the deaths from COVID-19. So that's not to scare people, but it's to remind all of us that it is really important that we do all that we can to keep West Virginia a great and safe place, as it's been through the whole COVID pandemic. And that's really, as the governor said many times, related to some smart moves that he made early in the pandemic, but also, most importantly, the great concerted community efforts of people in West Virginia. So West Virginia, it's really important as we look at the future for us that we stay safe, which is the best way to continue to open our vital businesses and really grow our economy. And you do this by wearing masks and staying separated and distance and washing your hands and avoiding your mouth or your nose or your eyes. And if you're sick, stay home. If you have a fever, stay home. If you feel not well, stay home and protect yourself and protect other people. And if we do that, we will be and will continue to be the place that everybody looks at longingly as a place that they wish they were from and lived into. So thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Thank you. Good afternoon, everyone. I want to mention an increase in our by our West Virginia Medicaid program to increase reimbursement to West Virginia eligible hospitals, our non-public safety net hospitals, in the direct payment program by the amount of $37 million. The hospital reimbursement increase is in response to COVID-19 costs and additional federal match dollars. Centers for Medicare and Medicaid Services issued guidance to states allowing more flexibility in utilizing directed payments to address COVID-19 costs and decrease revenues. West Virginia Medicaid is using an existing directed payment methodology to implement the additional hospital funding. The proposed $37 million in reimbursement increase is subject to final approval, and if approved, will be for services beginning July 1, 2020. First quarterly payments will be dispersed January 2021. Thank you.
All right, thank you, Secretary. Now we'll go to questions from media members. The first questioner we have today is Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, members of the Cabinet. I've been looking over the figures, and perhaps Dr. Marsh can help me out with this. Governor, yesterday you talked about the Hatfield and McCoy Trail and how you expected maybe to see a spike there that never really occurred. I'm kind of looking at the Morgan County numbers next to Berkeley County, and they are under 20 total. And at one point they were on, the high alert list. and Berkeley County is up over 420. It's hard for me to think that the people from Paw Paw quit going to Martinsburg to get their things during this. And then, of course, we have the Preston County situation where you have up to 42 cases tied to Myrtle Beach. And I'm trying to wrap my head around how all that kind of comes in and plays into this. Is it that the Preston County folks went into a congregate setting in a hotel down in Myrtle Beach, and that's what the problem is? And I'm just trying to figure out how all of those things are true in transmission and if the rules have changed any. Doctor?
Clay, you want to try that, or Bill?
Yeah, sure. No, I'm happy, Governor, to take that. So thanks for the question. You know, I think that your difficulty in piecing all this together is very typical of what we expected to see at this point and expect to see in the future, which is, as we've said before, COVID-19 is a pandemic. So there are many different sources of infection. We have said before that there are a few people who get infected that can spread the virus to a number of other people. And then there's a number of people that can get infected that don't seem to spread the virus very widely at all. And so I think that, we're seeing more mobility. We're seeing people that are traveling, and we know that as you go to high endemic areas of COVID, whether it's Myrtle Beach in South Carolina or going to Florida or Texas or Arizona or other places that are seeing new increases at the sort of the more logarithmic phase of COVID spread, it makes it more likely that you will be exposed to COVID and that you may contract it. And if you contract it, maybe you will spread it. So I think that we see differences in certain counties and certain populations related to the ability to spread. And as I would reason, that's probably related to the ability of people within those communities who have contracted COVID to be some of those people that can spread more readily than other places. So as we go forward, that's the reason why the governor and all of us have said over and over and over, you can't tell necessarily who is infected and who isn't. Because in the pre-symptomatic phase, before people get symptoms, or some people get only very mild symptoms, people may not even really know that they are infected and can spread to other people. So we need to protect ourselves and we need to protect each other. And wearing a mask is something that I know a lot of people don't like to do. It's not so comfortable. And some people, as we've said, may see that as an affront on some personal liberties. But to me, wearing a mask is a expression of love, of altruism, of protecting the people that we love and the vulnerable people in our community. And we want a vaccine and we want a drug. But honestly, if 80% or more of people wear masks, then we have the impact on that R factor, that reproductive factor, how many people get spread to, like we have a vaccine. So today we have the ability to stop the rate of spread of COVID in West Virginia if we all embrace this idea that we're going to take care of ourselves and we're going to take care of each other. So thank you.
All right, thank you, Paul. Next, we'll go to Anthony Izaguirre with the AP.
Governor, can you clarify how exactly the active caseload figures have been overstated, and what led to that, and how did you find out? Also, at what point would you strengthen restrictions on travelers as these Myrtle Beach cases continue growing?
Anthony, let me go to the second part of your question. I hope we're not going to have to do that, but if need be, we'll surely look at that. That's a step that is, I hope and pray, at least significantly down the road. But going back to the numbers and everything, just to tell it like it is, these numbers have just been reported to me in the last probably 24 hours. And we're digging deep into the numbers right now. And we are absolutely positive that if we are anything, we have overstated the bad, meaning that we don't have as much bad as what we thought we had. But that doesn't matter to me. You know, I mean, I want the numbers to be right, and you just got to give me just a little bit of time. It won't take me long now, but just give me a little bit of time. You know, I've demanded full-fledged transparency. I don't think we have a problem with that, and I've also demanded absolute accuracy. And we seem like we've got. I mean, I can't say it any more bluntly, you know, Anthony. It's just this. I don't have any idea how the number. Oh, I have an idea, but I don't look at how we assimilate 698 or whatever active cases, and I do not have the numbers of how we assimilate 750 recovered cases. Those are numbers that are coming into our people. But if the numbers come in for days on end and the numbers are showing, and let me just use Huttonsville for an example, but you know, if the numbers are showing that we have recovered at Huttonsville 110, well, first of all, they start off, we recovered, you know, we've recovered 50, and there's 70 that are still active, and then there's 80 recovered, and there's 40 still active, and that's the way it keeps going. Well, for crying out loud, I mean, you know, either you've got to be asleep or just absolutely not doing your job to have not updated those into the active versus recovered categories. And then when you come to me and say, oh, Governor, we got really great news for you and everything, we really overlooked this and we got a whole lot less active cases. That ain't going to cut it. That's just not going to cut it with me.
All right, thank you, Anthony. Next, we go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here, and not to drill down a little further into it, and you may be reluctant to even go this far. I'm certainly not asking you to blame anybody, but I recall early in this, a lot of the problems in regards to numbers where county health departments were very quick to release numbers to local news outlets, but sometimes they would do that before they actually gave those numbers to DHHR and the Bureau of Public Health. So it caused a lag, which was one of the problems that I think some of us had early on in this, because the numbers that were part of the statewide coronavirus dashboard were lagging as much as 24 to 48 hours behind what some counties were reporting. Is this an issue that's more of a state level issue to where we're just not keeping track of this quick enough, or is this a kind of a communications issue between county health departments and the state? Thank you.
Well, Stephen, I'm first and foremost not going to throw people under the bus. You know, I'm not going to do that right off the get-go until I know a little bit more. But I can tell you just this. You know me, you know, I'm going to just tell you the truth. I'm not going to give you any political gobbledygook. I'm going to tell you the truth. Right off the get-go, you know, we basically ran down a rabbit hole on the fact right off the get-go that we had our first death. And then we didn't have our first death. And then we ran down the same rabbit hole. Well, we've got, you know, a person that's passed away with COVID. And then it wasn't true. And so what did we do? And then in the beginning, we had all kinds of numbers floating around everywhere from the county health departments and so on. They were giving numbers, but they were a lag on how they were getting in the system, and there was all kinds of issues like that. And we stiffened every bit of that up. Now, listen, there is nobody that is more sympathetic to how hard everyone has worked. But it's hard for me to get by the fact that we've been at this now for months, and we're supposed to be doing a knockdown, drag-out job every day. Now, and when I come in here and I report to you that Huttonsville, we've got Huttonsville all the way down to 6 people, and yet we're still plugging in a number into our active cases that is enormously higher than that coming from Randolph County. I mean, we have got to be absolutely, you've either got to say, oh, well, you know, this and that and that. Well, I'm not going to say that. I'm not going to say that, because now Now we have been months into this, and they're in the old well. There's either one or two things happening. You know, to be good at any job, you got to have passion for doing the job and doing the job right. You know, or you got to, you know, either you're just dead level asleep at the switch. And that just, like I said, I can't be more blunt. I am not going to tolerate this. That's all there is to it. And so as soon as we find out the absolute answers, we'll act. And it won't be long.
All right, thanks, Steve. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor of the Kanawha County Commission has said it's made a request for CARES Act money for $10 million that they could distribute then to small businesses in the wake of the COVID-19 pandemic. And they cite other cities across the country as using the funds in this manner. They just submitted the letter, at least I just saw the letter yesterday, so it may not have come across your desk. But what are your thoughts about county commissions like Kanawha County using that COVID-19 money to help small businesses in the county who may have suffered devastating costs because of the pandemic?
Well, Kenny, I haven't seen the letter myself yet, but I'm just wondering if it's on Salango for governor stationary, you know, because all it is another political stunt. You know, really and truly, when you really get right down to it, on Monday, in fact, if not even last week, I started telling everyone that on Friday or the tail end of this week, I'd be coming out with a plan that would cover small businesses, it would cover our counties, it would cover all kinds of total explanation with complete transparency on how the numbers were all working. I was going to meet with the task force of the appointed people from the Senate and the House and on both sides of the aisle and everything, and we were simulating all that. We are so far ahead of these people, it's unbelievable. And what they're trying to do is just one-up politics garbage. That's all in the world it is and everything. They talk about, you know, how they're trying to help the Upper Kanawha Valley. Well, why in the world did they let the Upper Kanawha Valley die? I mean, that's all there is to it. It just died away and everything. And what we did is run to the rescue and everything with the Second Challenge Academy that's up there. So with all that being said, you'll see on Friday how all this will unveil, and it will unveil. And I would go back to tell the Kanawha County Commission and everything, for crying out loud, they don't need to, you know, to keep grandstanding. If what they want to do is put the Salango headquarters there, put it there. I mean, I don't care about that and everything. I mean, they're absolutely just doing nothing but politics and everything. And I am trying to look after not only Kanawha County, but I am trying to look after every county in this state. And that's my job. That's what I'm going to do.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, earlier you said that, you know, you don't have any concrete travel restrictions planned as of yet, but that may be something that we go to down the road. Today, states like New York, Jersey, Connecticut, they're implementing a 2-week quarantine period for people coming into the state. I know we had something like that in place earlier in this, but is a move like that part of what you may be considering?
Look, we are considering everything all the time, but now just think about this. From the federal government standpoint, whether it be a meeting with the president and the vice president, or it be a briefing from just the vice president, they are trying every way in the world to get the state's cumulative positive number below 5. Below 5. They're tickled to death when they get it below 5. We're at 1.67 right now. We're not New York or Arizona or Texas or wherever it may be, and I could be wrong. Maybe they have a decent, you know, number at some of those places or whatever it may be, but we're not those people. We are doing absolutely unbelievably good. And so we want to constantly consider and keep our numbers at where they are and keep them amazingly good. But at the same time, you've got to understand, we're not New York today. We're West Virginia. We're the miracle, and we want to stay the miracle. And I hope everybody heard me loud and clear. We want to stay the miracle. We're not going to become New York, God forbid, and everything. And we absolutely have all got to know we should all be concerned at all time, because we are the most vulnerable state, the state with the most chronic illnesses, the oldest. We're sitting in a sweet spot that could turn into absolutely a bad spot. And so we know what could happen. So absolutely, West Virginians, listen to me. Listen to me. We'll be on guard and watching nonstop, but we're not in New York today.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Next Star Media. All right, looks like.
Sorry about that, guys. Good afternoon, Governor and cabinet members. Given everything you just said, and I want to follow up on a question I asked the other day, because I know in your heart of hearts you want a lot of tourists to come in here for 4th of July weekend. A lot of the businesses do. People want to see West Virginia come back. But given the problems we're seeing in South Carolina, in Florida, in New York, what's your guidance? And I direct this to the doctors especially. What kind of precautions should people be taking? What kind of guidance should the state be stating publicly if we're going to have all these tourists come in here, given what's happened in other places?
Well, Mark, and you know, maybe Secretary Crouch or somebody could jump in and talk about this too. You know, all I would say, you know, our businesses are doing great work, you know, and we're doing everything from all the different stuff that we did at Hatfields and McCoy's trails, and the testing and the temperature taking and recommendation to wear a mask and stay home if you're sick, and all of these things we're already doing. They're working. I mean, you know, we wouldn't have a 1.67 positive cumulative test percentage if it wasn't working. It's already working, but you're right. The 4th of July, you know, surely creates additional potential problems and everything. And maybe Secretary Crouch weigh in on that.
Yes, sir, Governor. Especially if people are going out of the state on 4th of July, avoid airports if you can. Drive rather than fly. Avoid bus stations, train stations, rest stops when you're traveling. Carry wipes with you so that you can sanitize the doorknobs and everything. Be very careful. Wear your mask, as Clay says. We have to protect ourselves and not bring that disease back to us. Everything is mitigation of risks. If we speak with someone and we wear a mask, we're safer. If they wear a mask and you wear a mask, you're both safer. If you're 6 feet apart, that's safe. If you're 10 feet apart, that's safer. If you only talk for 5 minutes, that's safer than 10 minutes. You're really trying to mitigate your exposure to this disease, to this virus. So again, when people come in from out of state, it's a similar situation. In fact, more so. Wear a mask if you're around visitors who come in. Those individuals may not have symptoms and may have the virus. So we've said this before. I've said this several times. Act like you have the disease and act like everyone else has the disease in your presence, and you'll protect yourself more. So mitigate your risks, stay safe, keep your family safe. Thank you.
All right, thank you, Mark. Next, we'll go to Brad McElhenney with West Virginia Metro News. Brad, can you hear us? All right, looks like we're having trouble connecting to Brad. Kara Lofton with West Virginia Public Broadcasting. Kara, are you on?
I am. Hi, everyone. Kara Lofton with West Virginia Public Broadcasting. Can you guys address, I know in Shepherdstown, the mayor is considering an ordinance where they are not requiring everyone to wear masks, but they're going to allow businesses to ask people to leave if they're not wearing masks. Can you talk a little bit about why there isn't a statewide ordinance to wear masks in public places, since states like Virginia have done so? And what is your response to what's happening in Shepherdstown? Is that legal?
Secretary Crouch, go. Tell us about this, because don't know. I don't know specifically about that.
Yeah, there is not a statewide ordinance to wear a mask at this point. The governor's asking you to wear a mask, asking the public to wear a mask. Clay's talked about that. Again, it's the same situation in terms of trying to protect ourselves and protecting our families and the individuals we're close to. Individuals in counties, health departments could have restrictions related to masks, especially in working in restaurants and working in places that have the potential to spread the virus more. So there may be some local ordinances out there. From the standpoint of a state ordinance or an executive order by the governor, he has been very clear that is a difficult situation to get into. At this point, we're asking everyone to please continue to do your part as you have in the past and help keep us all safe.
Do you know, she asked, is there an ordinance that's been issued in Shepherdstown, at the city level? Do you know anything about that?
I do not know, Governor. There could be. That's a possibility for our local health department to do that. I do not know if there is one in Shepherdstown.
Okay, and Taylor, let me end up by just saying just what I've said before. But here's the problem, Taylor. It's just this simple. I'm telling everybody over and over and over to voluntarily wear the mask. Clay Marsh just told us just this. If 80% of the people, if we can get 80% of the people wearing the mask and everything, we turn and it's not but it's the number that basically tells us how the transmission is going and the percentage of transmission and everything and basically we turn that number south. And as we turn that number south, we shut this whole thing down and everything. Now, 80% of it. The problem that I don't want us to do is just this. First of all, it's almost impossible to enforce. And the second part of it is just this, is it will divide us. There'll be people that think now we've gone too far and we're really treading on their freedoms and lots of stuff and everything, and it will divide us. If we can do it on a voluntary basis where we're all pulling the rope together, we'll be a lot better off. And we want to continue to watch the numbers. Watch the numbers. Virginia's numbers are out of sight compared to our numbers. In fact, Virginia's numbers right today are at at 5 times. Virginia's numbers are 6.6%. Ours are 1.6%. Now, so the net of the whole thing is just this, is we got to watch the numbers. We got to try to be voluntary as much as we possibly can. We got to hit 80% or better. And at the end of the day, I don't know about Shepherdstown, and everything, but at the end of the day, what we really need to do is just this. We got to watch it. We just got to watch it. If the numbers move, and we have to move at some point in time to mandatory, even though it be really difficult, we got to do it.
All right, thank you. I'll go back to you, Governor.
Okay. Let me talk to you just 1 second about. I've mentioned Clay, and I mentioned the 80%, but I want to go back just 1 second on just that. Dr. Marsh says if we can fall below, and I always called it the R naught level, but Dr. Marsh, what is that level now called? It's
called the RT or R instantaneous. So basically, R naught is used when nobody has seen the infection before, but when people have started to see it and some people have gotten immunity to it, it becomes the RT, which is the value at the time that you're measuring.
Okay. But we're watching that number like crazy. And Dr. Marsh, none better. And if he tells us that at 80% wearing mask level, it makes that number go down. If we can stay voluntary, that is so much better off because then we're all pulling the rope together. We're trying to. Now, I want us to go back and think just a second about this. Do you remember when we started reopening and we started aggressively reopening stuff on Memorial Day or the Thursday before Memorial Day? All of us were holding our breath to some degree, really, really concerned about opening up the Hatfield-McCoy Trail. You know, all of us were concerned. And then all of a sudden, bingo, it kind of worked. And then we just keep moving along and moving along and moving along. Now we're watching. We're watching everything that's going on in other states, everything the federal government gives us, the medical institutions, our medical experts. We're watching. We're watching everything we possibly can. All I would say right now, I urge you beyond belief, especially in closed settings like church and everything, but absolutely anytime you go into a building, please wear a mask. Please, please wear a mask, except at your house, you know. But nevertheless, you know, I want to now jump to one last thing, and that's the money, the stuff we're going to be talking to you about on Friday. You know, I've told you all along, and I don't have a crystal ball, but I've got pretty good business sense because that's what I came to you as. I came to you not as a politician, but as a business guy. I came to you as a guy that's here to serve. And I came to you with a lot of experience in a lot of different areas. And when you have experience and you got white hair, you learn a lot from your mistakes as you go through life and everything. But this business guy told you everything was going to be okay from the standpoint of the economics within our state. And this business guy you'll see on Friday was dead right. Now, I do have one thing that I want to correct. Along the way here, you know, I don't know, a week ago or whatever, you know, it came out that there was $57 million that, you know, had been gotten from our congressional delegations and everything that was sent to West Virginia. And I said it wasn't here yet. Well, I was wrong about that. The money is here. The only problem with that is we have not received the authorization to be able to use the money. So we got the money, but it's like, well, we might as well not have the money because we can't use the money. And so with that, we're working on that and everything. But I don't want to ever report to you something that, you know, I am back double, triple hung up on one thing in my life, and that is just this. I'm going to tell you the truth. I'm going to tell you the truth every single day, no matter what the truth is, no matter how good it is or how much it hurts. I'm telling you the truth. And I have also told you over and over, West Virginia is going to be okay as far as the economics of West Virginia, and we're going to have lots and lots and lots of good surprises and good things happening with our small businesses and our counties and our cities, and we're going to some way, somehow get through this. Just continue to be the miracle, West Virginia. That's the main thing. Let's not let our legs get blown off here and, you know, end up in a real bad situation, a tough situation. But please, West Virginia, just keep being the miracle. Keep doing what you've been doing. Keep absolutely being smart and keep it going. Proud of you.